Moving from research findings to program strategy can be a challenge. In this video, we show you the steps we took to build a national communication strategy for improving infant and young child feeding in Bangladesh. Step 1. Engage an active team of partners. When Alive and Thrive began in Bangladesh, a number of groups were already working on child nutrition. We invited them to a workshop to plan Alive and Thrive's formative research. Our staff and consultants had reviewed existing data on child health and nutrition. The group's first step was to help decide what was missing and what our research should cover. Once we finished our research, we picked 12 feeding practices that needed more study. In our second phase of research, then, we would learn what people really can do and what motivates them. We used a method called Trials of Improved Practices, or TIPS. In TIPS, we ask a mother to try out a new practice. After a few days, we returned to ask about her experience. Her feedback helped us decide if the practice is something we should promote. With the data from TIPS, we prioritized a few feeding practices. For each, we asked ourselves, would this practice make a difference in a child's health and growth? Is there a gap between current practice and ideal practice? And is it possible for families to do it? Here's how we assess the practice: feed your baby animal source foods starting at 6 months. Would this practice have a positive impact on a child's health and growth? Yes, adding animal source foods is one of the most reliable ways to improve a child's growth. We knew from earlier research that few mothers gave animal source foods to babies. We knew that most families had foods like fish in the household. They just didn't think it was proper to feed these to babies under a year old. But from TIPS, we knew we could convince mothers to try it, and that once they tried it, their fears about the practice evaporated. For step 3, we would agree on the key practices to promote. After assessing many possible practices in this way, the group reached agreement on 4 priority practices we would all promote. Here they are. Step 4. Name the audiences and the best channels for reaching them. We knew that mothers were our primary audience. The secondary audiences would be the people who influence a mother's feeding practices: baby's father and grandmother, doctors and midwives, teachers and religious leaders. Channels to reach them? Face-to-face counseling, group sessions, and mass media. We had thought radio would be best, but switched to TV after we learned that more families use TV than radio, even in poor neighborhoods. Our group had agreed on a national communication strategy that clearly laid out priority feeding practices, key messages, audience, channels, and even the indicators to evaluate whether we were reaching our targets. Step 5. Down to work. In our wrap-up workshop, each organization volunteered for the parts of the campaign it would carry out. All members feel ownership. Following these steps ensured that the research findings led us to a practical action plan that really is strategic. Here, again, are the steps we took to build a strategy. Step 1. Engage a team of partners. Step 2. Learn about behaviors. Step 3. Agree on key practices to promote. Step 4. Name audiences and channels. And Step 5. Down to work. Pulling together behind a strategic plan, we expect to see real improvements in the ways families throughout Bangladesh feed their children, and more strong, smart, and healthy children.